Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mujahid Buneri. Welcome to the channel Dr. Mujahid Buneri. Are you aware of the fact that irritable bowel syndrome is the most common gastrointestinal disease diagnosed by gastroenterologists in USA? I hope you understand that today our topic of discussion is irritable bowel syndrome. Before starting the lecture, I would like to inform you that the learning objectives of today's lecture are 1. What is irritable bowel syndrome? 2. What are the causes of irritable bowel syndrome? 3. How will you diagnose irritable bowel syndrome? 4. How will you treat irritable bowel syndrome? At the end of the lecture, I will ask 3 questions. You can give your answers in the comment section below. Okay, let's begin. What is irritable bowel syndrome? It is a group of symptoms including abdominal pain and changes in the pattern of bowel movements without any evidence of underlying damage. It means that in irritable bowel syndrome, there will be symptoms such as abdominal pain, diarrhea, constipation, or both, alternating with each other for prolonged time. But there will be no evidence of structural damage to gastrointestinal tract because it is a functional gastrointestinal disorder. The usual onset of disease is before 45 years. It is estimated that about 15 to 45% people are affected from irritable bowel syndrome worldwide. These stats show that it is a common disease. Irritable bowel syndrome is 2 times common in female as compared to male. Moving on to the causes of irritable bowel syndrome. The exact cause is still unknown. However, it is believed that gut-brain axis is affected. Gut-brain axis is a bidirectional communication between central and enteric nervous system, which is affected in irritable bowel syndrome. The risk of IBS increases sixfold after acute gastrointestinal infection. Thus, it is the most common trigger for IBS. Other risk factors include younger age, prolonged fever, anxiety, and depression. Okay, what are the clinical features of IBS? It includes 1. Abdominal pain, 2. Constipation, 3. Diarrhea, 4. Both constipation and diarrhea alternating with each other, 5. It is not associated with weight loss. Weight loss is not a feature of irritable bowel syndrome. 6. It is not associated with blood or mucus in stool. Absence of weight loss, blood or mucus in stool differentiate irritable bowel syndrome clinically from their differentials. How will you diagnose irritable bowel syndrome? The diagnosis of irritable bowel syndrome is clinical. There is no specific diagnostic test for irritable bowel syndrome. The first step is to exclude lactose intolerance, celiac disease, inflammatory bowel disease, giardia infection, and anatomical defects of the bowel. These differential of IBS will be excluded with the help of detailed history, relevant examination, and relevant investigations. The diagnostic criteria for irritable bowel syndrome is based on clinical symptoms called Rome criteria, and these symptoms must occur for at least 3 months before labeling a person as patient of IBS. It includes the abdominal pain relieved by a bowel movement. 2. The symptoms are absent or fever at night. 3. Diarrhea alternating with constipation. Now, how can we treat irritable bowel syndrome? 1. You will advise high fiber diet. 2. You can prescribe antispasmodic agents such as hyoscyamine, dicyclomine, etc. 3. You can also prescribe tricyclic antidepressants such as amitriptyline or selective serotonin reuptake inhibitors. If a patient has predominantly diarrhea along with abdominal pain, then you can give antidiarrheal agents such as loperamide. You will also prescribe non-absorbed antibiotics such as rifaximin. In contrast, if a patient presents with constipation predominant irritable bowel syndrome, you can prescribe non-absorbed bowel lubricants such as polyethylene glycol. Moving on to the last section of lecture, it includes 3 questions. 1. What is the difference between IBS and inflammatory bowel disease? 2. Enlist 5 triggers for IBS symptoms. 3. What is the difference between disease and disorder? This was all about today's lecture. Thanks for watching.